Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the second cluster C, or anxious or inhibited disorders, namely the dependent personality disorder or DPD in detail. In this episode, we consider the third cluster C, or anxious or inhibited disorders, namely Obsessive Compulsive Personality Disorder or OCPD in detail. Obsessive Compulsive Personality Disorder belongs to the cluster C, namely the group of anxious or inhibited disorders, which involves anxious, fearful, or inhibited thinking and behavior. Obsessive compulsive personality disorder is a mental health condition that involves consistent and extreme need for and extensive preoccupation with perfectionism, organization, rules, procedures, and control, with no room for flexibility, often caused by rigid beliefs and need to control oneself, others, and situations, which in turn can interfere with completing tasks and maintaining relationships. Obsessive compulsive personality disorder, or OCPD, is a separate condition from obsessive compulsive disorder, or OCD, which is classified as an anxiety disorder. The basic difference between the two is the following. People with obsessive compulsive disorder are aware that their condition is causing their behavior and accept the need for change in their lives. However, people with obsessive compulsive personality disorder usually have hardly any self-awareness of their obsessive and compulsive thought patterns and behaviors. They do not think that their way of thinking or behavior is problematic. Hence, they are also totally averse to making any changes in their lives. Thus, when you are affected by obsessive compulsive personality disorder, you become uncomfortable in situations that are beyond your control. You can be stubborn and insist on doing things in your way. You follow rules and procedures rigidly, exhibit perfectionist behaviors, and have a need to maintain strict control over people and circumstances in your life. This can make you severely self-critical and critical of others. Since you have an obsession with order and you are opposed to change, you are extremely bothered, anxious, and troubled about a disrupted routine. You tend to focus overly on details and schedules, hard and excessive work, not allowing time for leisure, recreation, or to be with friends, and being inflexible in your morality and values. With rigidity in your beliefs, being fixated about doing tasks in a certain manner, and being inflexible, you will have difficulties compromising, accommodating, and collaborating with others, whether they are your family members, friends, or co-workers. As a result, you may encounter difficulties both in your family and work settings regarding making decisions, completing tasks, and maintaining positive or healthy interpersonal relationships. Similarly, since you have difficulty in expressing emotions properly, it would be hard for you to build up a strong romantic relationship and to have affective relationships with your children. Likewise, your moral or value fixations make you think in a black and white manner about your or other people's beliefs and behaviors, which can make you to act out with righteous indignation and anger in response to a wrong belief and behavior, causing breakdown in relationships. All these can make you socially and relationally isolated, solitary in your endeavors, and to mistrust the help of others, leading to anxiety and depression. Common symptoms of obsessive compulsive personality disorder include inflexibility, which consists in excessive preoccupation with or being unable to agree to changes to details, lists, orderliness, rules, procedures, schedules, or punctuality. Rigorous perfectionism, that is, extreme conscientiousness that interferes with task completions. Work life imbalance, which consists in undue devotion to work that interferes with social and personal life. Intimacy avoidance, that is, avoiding close friends, family, or romantic relationships. Risk avoidance, which consists in not taking risks, fearing that it may lead to failure or uncontrollable situation. Being fixated, rigid, and stubborn in beliefs and ways of doing things. Unwillingness to delegate tasks due to fear that they won't be performed according to strict standards. Manifesting extreme frugality or miserliness. Strict adherence to moral and ethical code, rules, and regulations. Manifesting excessive doubt and indecisiveness. Overwhelming need for order and environmental control. Difficulty in coping with criticism while overcritical of other people's flaws. And hoarding useless and worthless items with no sentimental value. Though these symptoms may begin from childhood, they begin to manifest during late adolescence or early adulthood, that is, from age 18 to the 20s. Researchers indicate that this disorder is common among adults whose highest education is high school level or less. Obsessive compulsive personality disorder affects 3% to 8% of the adult population. It is twice common among men as in women. It is unclear as to the exact causes of obsessive compulsive personality disorder. Since disorder runs in families, most experts believe that genetic predisposition plays an important role. Hence, malfunctioning of genes, genetic links to aggression, anxiety, depression, and fear within the family may trigger the origin and development of this disorder. Similarly, researchers indicate that people who grew up in environment that is characterized by intimacy avoidance, restricted expression of emotion, and inflexible perfectionism, excessively rigid childhood upbringing, childhood abuses and traumas, and people grew up under highly controlling, punitive, or protective parents are prone to develop obsessive compulsive personality disorder. Thus, a combination of genetic and environmental factors contribute to the emergence of obsessive compulsive personality disorder. Obsessive compulsive personality disorder cannot be prevented as symptoms develop from childhood and get manifested only in early adulthood. Neither can this disorder be cured, though symptoms may lessen over time with treatment. Hence, many of the problems related to the disorder can be lessened if treatment begins as soon as the symptoms appear. Hence, with treatment, the prognosis for the obsessive compulsive personality disorder is positive, and it can help decrease the disruption to a person's life, family, and friendships. However, success requires a commitment to recovery and sticking to therapist's treatment plan and instructions. Left untreated, the prognosis and long-term outlook for obsessive compulsive personality disorder is not that positive, as it may result in poor relationships, occupational difficulties, and impaired social functioning. Besides, it can also cause anxiety, depression, anger management issues, and substance abuse disorder. Diagnosis of obsessive compulsive personality disorder is often difficult, as most people with this disorder do not think that there is a problem with their way of thinking and behavior. They often seek help because symptoms have been severe and their life becoming unmanageable. Diagnosis begins with a physical examination by a medical doctor to rule out any physical cause of the condition. Then the client is referred to a mental health professional who makes a comprehensive psychological evaluation of the client after taking into consideration the situation of the client and accompanying symptoms. Having done this, the mental health professional will carefully review it, compare symptoms, history, and the psychological evaluation results with the standard obsessive compulsive personality disorder diagnostic criteria, which include first, extreme perfectionism, second, work-life imbalance, third, intimacy avoidance, fourth, inflexibility, fifth, risk avoidance, sixth, reluctance to delegate responsibilities, seventh, being frugal and miserly, and eighth, extremely rigid and stubborn. If any five of the above conditions are applicable in case of the client, the mental health professional could conclude that the client suffers from obsessive compulsive personality disorder and prepare a specific treatment strategy that fits the patient's individual mental health needs. The treatment of obsessive compulsive personality disorder includes medications, therapy, and relaxation exercises. Since there is no specific obsessive compulsive personality disorder medication, medications serve the purpose of reducing symptoms from mental health conditions such as anxiety, depression, and drastic mood changes that co-occur with the disorder, thereby get the client more ready for and engage in therapy. Any therapy that helps the client to have greater self-awareness and insight into his mental health condition, to equip the client with new coping skills and adjust thought patterns to increase quality of life, to modify ways of thinking and doing that leads to negative emotions and behaviors, to change the client's tendency to be self-critical and critical of others, and to provide the client with new tools to derive more enjoyment from interpersonal relationships and recreational activities, rather than focusing so heavily on work, could be used in the treatment process. People affected by obsessive compulsive personality disorder would also benefit from self-help skills such as specific breathing and relaxation exercises and practice of meditation so as to reduce the intense sense of urgency and stress common in people with this disorder. By managing the conditions accompanying the obsessive compulsive personality disorder with medication, learning to deal with the symptoms of the disorder through therapy, mitigating the urgency and tension associated with the disorder with the help of relaxation exercises, and focusing on proper management of the current living rather than focusing on long-term cure, you can deal with the impact of obsessive compulsive personality disorder reasonably well. In the next episode, we will begin our analysis of communication disorders. Thank you for watching this video. Stay blessed until we see you again with another video.